So this is 5 Minutes with Ariel. Enjoy. Today I'm going to be talking about one of my clients who's 4 years, 1 month old. He's been in therapy since January of 2017, and he's diagnosed with selective mutism. So this diagnosis is secondary to his diagnosis of an autism spectrum disorder. When we first started seeing him, he would not say a word. Absolutely nothing. He would just sit in the chair. He was very uncomfortable. As in selective mutism, it's related to anxiety a lot of times in social settings. So it was a setting he wasn't used to. He was coming new to therapy. He would speak with his mom, and his mom would say, "Oh, we're going to go to therapy." He would say our names. He knew who we were. But as soon as he was getting in here, if he was singing a song, he would stop. So we didn't see him speak for at least a few months after he started therapy with us. So one of our main goals right now is just getting him to identify and label common objects such as household objects, foods, and toys. So things that he would see on a regular basis. And also to respond to greetings, say hi appropriately, ask for things with 2 or more words. And right now we're getting him to say, "I want ball," "I want puzzle." He's gotten a lot better with that. He knows what my name is. He always says, "Hi, Ariel." I don't have to say hi first, so he's doing really great. Some of the picture cards that we use are picture cards like this, banana, stuff that he's really used to seeing and eating at home. And then I'll give him a field of 4 cards. I'll ask him to give me one of them, for example, banana out of 4. He often repeats it. And since he does have a lot of echolalia, instead of me saying, "What is this?" I try often to just hold it up in front of him, or I'll put it on the table in front of him and I'll point to it. And that way it just kind of gets him to say the name of the object rather than having him repeat, "What is this?" "Potato." A lot of times he needs phonemic cues. I try to get him to ask for help before I give it to him, which has been the most difficult thing for him right now, because he'll be sitting in front of an object, and if he doesn't know something, he'll just tap it instead of saying, "Help me, please." So now I'm getting him more comfortable with asking for help, and I'll give him the phonemic cue like "put," and eventually he does get it. If he doesn't get it, he does pick up within about a week or so the new object. So he's been doing really, really well. I want to grab the token chart that we use. So this is the token chart I use for him, and I'll do about 20 cards at a time. So for about every 4 cards, I give him a token. When he gets his 5 tokens, he gets a few minute break, and I'll have him request what he wants on his breaks, if he wants Legos. And when he is playing, he's able to ask for help, which is really great. He needs a lot of breaks. He at the beginning needed a lot more breaks than he does now. So his attention span has definitely increased. He's much better at sitting in chairs, at following commands. But oftentimes if he doesn't understand something, like he didn't know how to clean up, for example, we just do a lot of hand over hand with him. He does really well with tactile and physical cues as opposed to verbal cues, because otherwise he'll echo what I say. But he's come a really long way. He's able to identify things. His mom and dad are saying that he's talking a lot more at home. So it took a lot. The first thing we had to do really in therapy was just gain rapport and compliance, and just make him comfortable in the setting that we were in, so that every time he knew he came, he knew he would have to sit down, he would have to take his tokens off. So now every time he comes in, the first thing he does is take off his tokens. He sits in his seat. And actually something that's a little bit unrelated, but we've noticed, is that he doesn't know how to sip from a cup. He uses a sippy cup. So we're also trying to incorporate that into our sessions. His mom will bring a bigger water bottle for him. He doesn't really have lip closure because he's never used a cup before. So whenever he comes in, he wants a drink, he'll ask for it now. And I just kind of help him with his lip closure, and knowing how to put his lips around the bottle and swallow it rather than it drooling all over him. But all in all, he's come a really long way. It's something I had never seen before. I had never been with a selective mute. Throughout the sessions, when he got a little more comfortable, he would start letting words slip by mistake. He didn't realize that he would say "uh-oh" when something fell. So the more comfortable he became, the less crying there was. He was a lot happier, and now he comes to therapy and he loves it, and he knows who we are. He knows how to request things, and he's proud of himself because he knows that he can do things that he couldn't do before. So it's really great, and I'm really happy for him, and I can't wait to see him continue to grow. Bye.